Hey everyone, we're decided we're going to post a little video today. I know a lot of you know that we've been talking to everyone about taking vitamin D as a supplement and ad nauseum, I suppose. But anyway, I know there's been some confusion as some people have been asking, well, is it safe to take supplements, vitamin D supplements, and how much should they take, and so on and so forth. And there's some different guidelines that people are confused with that are the official guidelines. Uh, if they don't understand how they work, they may be concerned about which amounts they should take. So anyway, we're going to put some links on our website as to more information about what you should take and the reason you should take it specifically. The reason we've been going on about vitamin D is that it is essential to having a healthy immune system. And we both believe that your best defense against a virus is to have a healthy immune system. And having a healthy immune system is you need it to fight off any virus and all kinds of other things and ward off other diseases and so on. So that's just goes without saying, really. But especially with this virus, there's some things that are happening that have been really interesting that everybody should be aware of. And some of this will be stuff that you've probably seen in different places. Hopefully we can put some things on here that will give you somewhere that you can reference some of the stuff that we've been looking at and see why we think it's so important. First of all, let's look at a chart. This is a chart out of Indonesia. This was a test or an analysis of people that were showing up at the hospital with symptoms of the virus. And one of the first things the staff at the hospital would do when somebody came in complaining about virus symptoms was they would give them a blood test. And from there, they would, of course, either be admitted or told to go home and self-quarantine. And later, they analyzed the results of what was happening with some of these patients. And one thing that stood out was when they looked at the vitamin D levels that these people had when they first were checking in or coming into the hospital for help. They looked back and looked at the results and how the cases went. And what they found was a huge correlation for the vitamin D levels that these patients had. Pretty much accepted by the medical community that if you have less than 20 nanograms, this isn't a blood plasma test, less than 20 nanograms per milliliter of vitamin D, you're considered to be deficient in vitamin D. And if you have a level that ranges from 21 to 29 nanograms, that's considered insufficient. And 30 and above is considered to be sufficient. That's the green color there. So if you look at these things over on the left, the results were pretty amazing. That the people that had were critical, a lot of these people, I'm assuming, died, were primarily in the group that were considered to be deficient or insufficient in vitamin D levels. Even those that were considered to be severe, same thing, all deficient, mostly deficient in and insufficient in vitamin D. Very few people that had sufficient vitamin D levels got severe cases or critical cases. Even in the what's that say? Average? No.
Or ordinary.
Ordinary. I don't know what ordinary means, but same thing. It's still dominated by deficient and insufficient numbers. And then over on the right, the people that had mild cases, I mean, it's 96% of these people had vitamin D levels above 30. Now, what that implies, and as they say, causation is not, or correlation is not causation, but what this implies is that if you have sufficient vitamin D levels in your blood, that you will get a low level case of the virus if you contract it at all.
That chart was from the Philippines, and there was another study out of Indonesia, and also they tested in New Orleans as well. So they came out, all three studies showed about the same results.
Which is pretty amazing. And that's why I say, go look at the full video where they go through a number of these charts. Ivor Cummins, there's also one from Rhonda Patrick and Joe Rogan. That's on our website as well. Check that out. Most of the people that are dying from this disease are elderly, or they're people that are overweight, or they have a dark skin coloration, and or they have other factors that are affecting them, such as other diseases or immune deficiencies and so on, right? So it doesn't seem to me that that is just a coincidence, but that same group, those same groups of people are also the ones that are most likely to be deficient in their vitamin D levels. That's something that needs to be looked into. Why is that? Also, the other thing that stands out is that the flu season, everybody's sort of gotten used to the idea and accepts it as fact that the flu season tends to taper off in the summer. In fact, there's been a lot of the guesswork has been around, well, maybe the virus will die off in the summer. You know, what's different in the summer? And when I say that, I mean in North America, but this is probably the same year round. What do we do in the summertime? Right? Well, a lot of us, you know, we wear less clothes. We are walking around in shorts and t-shirts. We're getting more sun, so we spend more time outside. We get more sun. We get more UVB rays, which means it builds up our vitamin D levels, which in turn builds up our immune system, which means that quite possibly we don't get it in the summer because we have more of a resistance to viruses in the summer because our immune systems are collectively stronger.
Yes.
I mean,
yeah.
Wow, that's so simple.
Yeah.
I guess the thing is, you know, if vitamin D is something that could help overcome this virus, then it's worth our while, all of us, to take it, to look into it and find out more about it. I mean, we're not going to presume to advise you what to do. We're not medical experts by far, but what we do is based on things we've learned by reading about this stuff and searching the internet, looking at studies, looking at videos from people that are experts in the field. And that's why we're posting these things on our website. And we take supplements every winter when we're in Canada. I mean, and a lot of you know for the last 25 years or so, we've been spending most of our winters in places like Mexico and stuff. And of course, that's just because I'm cheap and we're looking for some cheap vitamin D to soak up, nothing to do with beaches and anyway,
margaritas or anything.
But when we're in Canada, we take supplements, and you know, it's also probably because Joan's advancing years, you know, you have to take more. Your skin can't absorb it when you get older. But you can take it from supplements. You can also get it from your diet. So, Joan, you're the expert on this. Where can people get this from their diet, and how does that help them?
Well, clearly a balanced diet is key to all health. But specifically for vitamin D, you actually don't get a lot of vitamin D from foods. Maybe, I think it was about 10%, maybe. I think that was the number that we found. So the foods that do have it are the fatty fish, salmon, tuna, mackerel, beef liver is really good, egg yolks, cod liver oil is great. That is one of the best sources, and some mushrooms. Clearly, that is not on the top of a lot of people's Western diet. You know, like, let's have a serving of cod liver oil, yum. The Western diet, most people love, which is processed foods, industrial seed oils, and sugar, which is horrible. Now, they try and fortify, the companies try and fortify milk and cereal with fortified vitamin D. But when you think of how much sugar is in the cereals that have the vitamin D, you know, just leave them on the grocery store shelf. Supplement instead.
Yeah.
We'll get into a whole new thing about sugar at another time. But anyway, the point is just a balanced diet, and supplementation is key for those who live in the northern climates. So I think you have more information on the supplementation, so let's get into that.
Yeah. Okay. So let's actually that brings us to the guidelines. And
Yeah.
there's this is where if you can put up that chart from the Endocrine Society, there's some confusion as to what the guidelines say, and I'll just get my chart here. Yeah. Now this chart is from the Endocrine Society, and the Endocrine Society is endocrinologists. These are the people that look at health from a point of view of metabolism and your hormones, and vitamin D is a hormone or is a precursor to a hormone. And these are the experts. These are the specialists. They specialize in this. And this chart that shows the nutrient guidelines that are posted by the federal government in the United States, and also the recommendations that the Endocrine Society posted in 2011. And when they did this, they did a meta-analysis of all of the studies and that were out there and the results they were getting. And basically, they're referring to a lot of excuse me, studies that show over 70% of Americans are insufficient or deficient in vitamin D levels. Well, and they suggested that the stated levels, which most people are familiar with, which is 400 international units per day, they said that those are actually too low. The recommended data, and the on the left it says IOM recommendations. That is the International Order of Medicine or something.
Institute of Medicine.
Institute of Medicine. Okay, those are the requirements they put out. And if you look down there, let's just go down to the 70-year-old or adults, male and female. There goes the estimated, what's that year's estimated average?
Estimated average requirement?
Yeah, and that is the 400 international units per day. But if 70% of people are deficient in vitamin D, then 400 international units is not going to do much. So you can assume that that 400 international units applies to 20 to 30% that have sufficient levels above 30 nanograms already. And if 70% are insufficient, you need to sort of look at these charts and look at this information and decide, well, where would you fit in? You know, where do I fit into this group and what should I be taking? But so their units goes from recommended daily allowance, and it shows, you can see there it goes for adults 600. If you're over 70, then it goes up to 800. And then the UL category, which is the upper limit, they put at 4,000 international units per day. Now, and if you go over to the right, the committee recommendations from the Endocrine Society, the experts, said that actually they feel that those recommendations are too low, and they think the rate should be from 1,500 to 2,000 international units per day with an upper limit of 10,000 units, which is 4 to 5 times higher than what most people are familiar with from the Food and Drug Administration or wherever they see these guidelines posted. And that will probably be the guidelines that you see posted on all the vitamin D labels that you take as well. So Joan and I take 4,000 international units a day when we're in Canada in the wintertime. And again, we actually take them year round now. But I feel quite comfortable taking that amount simply because that fits within the guidelines from both of these agencies. And, you know, and I have also seen lots of reports and studies where people and doctors and scientists are recommending that that's the amount that people should take, or that's the amount that they take personally. Mm-hmm. So, I think everyone should look at this and just see where they fit in. And I mean, by all means, talk to your doctor. Ideally, everyone should get a blood test. Find out what your vitamin D levels are. Also talk to your doctor, find out what, you know, there is some, you can take too much, but that is a lot more than what
pretty rare. The upper limit, I mean, it's toxicity and is very, very rare with vitamin D.
Yeah, there are some metabolic disorders that some small portion of the population may have that makes it they can't process vitamin D the same way other people can, but that's a very small minority. But again, this is where you talk to your doctor, get the test done, find out what your vitamin D levels are, and then find out what you have to do to safely increase those levels to somewhere between 30 to 40 nanograms. And again, use the sunshine. That's the easiest route. Don't get a sunburn, but get out in the sun. Get your kids. Kids should be out in the sun, getting sun for 20 minutes. What was the amount you get from the sun?
It's 20,000 units for 20 minutes in the sunshine, between 10 and 2. Yeah. Just an add note about the blood tests. I don't believe they're standard in a blood test, so you actually have to request getting your vitamin D levels tested.
That's right. So yeah, make sure the doctor that you specifically say you want to find out your vitamin D levels. You can't be sure that taking vitamin D is going to be the magic vaccine that we've all been looking for. These results are pretty phenomenal, but what's the bottom line? What's the worst case scenario if you take vitamin D and, with all the precautions in place, but if you're taking vitamin D or however you get your blood levels up to 30 to 40 nanograms, you're going to be healthier. That's the worst case scenario, right? You're going to be healthier. You're going to have more resistance to disease and autoimmune diseases and other things like cancers and so on. All of that information, we've also posted the link to the Endocrine Society. You can see the benefits of vitamin D, what it'll do for you. But if the bottom line is you're getting healthier, then that's a risk I'm worth taking. Instead of just putting up with this thing, maybe we can take the fight collectively. We can take the fight to the virus. It's something each of us can do individually. It doesn't have a high risk. It has all kinds of benefits. Yeah. And maybe one of the side effects will just be that you don't get the virus. Wow. Wouldn't that
healthier overall?
Exactly. Yeah. It's just something we should all be doing. So I hope you look at this stuff, educate yourself on what you should be doing or what you can be doing yourself instead of waiting for the government to find an answer, which quite frankly, a vaccine may take years or it may never come.
Yeah.
We don't know. So hopefully this helps and I hope you find it interesting. Thanks for watching.
Thanks for watching. We'll see you next time.